We'll dive into the pulmonology section now. So now we'll see the common pulmonary testings that are commonly being done. Okay. So first thing that we are going to see is a ventilator management. So this would be a little popular at this time of this COVID infection, right? So people being placed on ventilators, and that has been a huge controversy as well. Okay, so we have codes for ventilation management for the initial day and subsequent day, things like that, and whether the patient is in a hospital or in a nursing facility, the codes differ. Again, we have this home ventilation service that can also be separately reported. We have this spirometry. If you remember, what is spirometry? It is a measurement of the lungs, right? We do like respirometry. Actually means it is a measurement of your inhalation and expiration. We have so much of lung volumes that need to be studied. We have this tidal volume, the forced expiratory volume, the inspiratory volume, what is the capacity of the lungs as vital capacity. So there are so many measurements and studies about lung itself. So for each of those we have separate codes. Next we can see patient initiated spirometry technique. We can report that with the CPT 94014, and for recording it's 94015. And bronchodilation responsiveness, bronchodilators, usually for treatment of asthma, we have substances that essentially dilate the bronchus. So bronchodilators are prescribed. Next we have this bronchospasm provocation. So they give a drug and they are going to see if this methacholine, things like that, they are just going to see whether this patient has asthma or not. The degree of where it's spasm, bronchospasm, it's constriction of the bronchus, that will be studied and assessed whether this patient has asthma or not. We have this vital capacity, expired gas collection, and breathing response to hypoxia. And we have this pulse oximetry. That's the commonest place that we often find here in this pulmonology chapter. Next we have this PFT, pulmonary function testing. Next we have this 6-minute walk test. So where the patient would be asked to just walk continuously for 6 minutes and his respiratory patterns are noted by the nurse. So for that we can report CPT 94618. And for inhalation treatment, we can resort to code 94640. That's the inhalation of a non-pressurized inhalation for acute airway obstruction. Then we have the CPAP, continuous positive airway pressure management. So CPAP measurement, we have specific codes. And then we have this mechanical chest wall oscillation. We have plethysmographic studies. They are going to see the lung volume changes, especially with the air. We also have this lung compliance study where they are going to check the elasticity, how long the lung can contract and expand as well. So that is a lung compliance study. So we have so many studies like, circadian respiratory pattern, and we have this carbon dioxide determination, and there are so many other pulmonological studies which can be easily coded based on the type of test that is being done.